Good morning and welcome to our call-in show on COVID-19. I'm Anjali Istiwal, and answering your questions will be two doctors who are joining in right now. We have with us Dr. D C Sharma. He's an endocrinologist from Strajan Hospital in Udaipur, and also joining us is Dr. Suhas Hardas. He's an interventional cardiologist from Hardas Heart Care in Pune. Thank you, doctors, for joining in, and we'll try to get our callers as soon as possible. We have our first caller joining in right now from Pune. Dr. Sheetal Ghodke is with us. Yes, Dr. Ghodke, please go ahead and ask your question.
Yeah. Very good morning.
Good morning.
My name is Dr. Sheetal Ghodke and I am a family physician from Pune. And my question is for Dr. Suhas Hardas.
Right.
Yeah, I just want to know what are the drugs found to be effective in treating COVID-19 infections currently?
Right. Dr. Hardas?
Yes, that's a good question, Dr. Sheetal, and good morning to all of you. Basically, I would start by saying that not a single drug has been found absolutely 100% effective, but there have been trials. This virus is new to us. We are still learning a lot about the virus. We are learning a lot about how to develop the vaccine, how to develop the immunity. What are the consequences? Is the immunity going to be long term? But during this period, if we have had sick patients presenting with corona infection, then there have been trials with hydroxychloroquine, there have been trials with azithromycin. People have tried drugs from the Zumab family. Then there is a drug called remdesivir, which has been tried in certain trials. There has been a French trial, there have been trials in the US. For more sicker patients, there are more options like giving high-dose steroids. In a situation where the patient is on ventilator and hypotensive, multi-organ failure, desperate situations like plasmapheresis has also helped. But the bottom line is that there is no single drug which is found to be very, very effective, and we are still probing. And we are still kind of in the haze as to which remedy or which drug will work the best.
All right, and we are hoping and praying that a suitable treatment is found as soon as possible. Let's go across to our next caller. We have Suryaveer from Amreli in Gujarat. Suryaveer, please go ahead and ask your question.
Good morning, madam.
Good morning.
My question is that I am an engineer and working in this Ultratech cement.
Right.
My problem is that we are working in an office building, and there are so many offices in that building. Cabins are also there, and we are using centralized AC system. We
Right.
are using centralized AC system.
Right.
If one of our colleagues is suffered by this COVID, then through this centralized AC, other person can affect or not? That
Right.
is my question.
Right, Dr. Sharma.
Yeah, good morning. It's a very interesting question, very relevant question as of now. What has been observed is the closed environment in air conditioning, closed air conditioning might spread the virus. So it would be advisable not to use the air conditioning right now, and to keep the windows open, to keep the surroundings more open would be a safer thing to be observed.
Absolutely. So a well-ventilated room is what all the doctors have been suggesting. So this is very important. But what about home air conditioners, doctor?
Home air conditioners can be used as long as there is nobody infected in the home or no suspicion, nobody is sick. We can safely use the home air conditioners. There should not be any problem in using home air conditioning or the window coolers and likewise.
Absolutely. So very important there. If you're working in an office which has central air conditioning, then maybe it's time to suggest your office administration to not use that and open up those windows, crack open those windows. We'll be bringing you more questions from Dharwad now. Krishna has joined us online. Yes, Krishna, please go ahead and ask your question.
I am calling from Thyroid, Karnataka.
Right.
Hello?
Yes, we can hear you. Please go ahead.
My question is that, hello?
Yes,
my
we can hear
question
you.
is that, what measures are to be taken with regard to vegetables and fruits? Whether they can be used instantly or kept for some time.
Right.
Say about 48 hours like that.
So fruits is something that they're concerned about, eatables like fruits or vegetables, doctor.
Yeah. In fact, fruits and vegetables can be very well used. I mean, the only precaution to be observed is wash them thoroughly. Wash them repeatedly, maybe with the lukewarm water or warm water, and you can safely use the fruits. There should not be any problem in using the fruits and vegetables. So you can safely use.
Right. What about, Dr. Hardas, what about certain people advising, and a lot of WhatsApp forwards coming about washing the fruits and vegetables with soapy water or disinfectants? How safe or how bad for the health, or how safe is it?
I think once again it's a grey zone. We really do not know. We pretty well sure know that sanitizing yourself, sanitizing your hands with soap, with sanitizers, with alcohol-based sanitizers definitely works. But whether the food articles, especially the fruits, can be washed to the extent of getting rid of entire corona that may be sitting on these fruits is very difficult to say.
Right.
But nonetheless, there is a clear evidence that whatever comes inside your house and whatever is kind of imported from outside, you have to make sure that it is exchanging hands least possible, and you sanitize them, whether you sanitize them with alcohol first and then wash them clearly and then use them, or you wash them directly with soap and water, is probably anybody's guess at this stage. But however, I would suggest some of the practices that have been ongoing, that have been suggested, and I've been reading on various social media, that people probably take these deliveries, bring home some fruits and make sure that they are washed thoroughly well, as Dr. Sharma said, with lukewarm water and soapy water, and then use these fruits.
Right. Okay, so be very careful with what you're bringing into your house. Joining us from Udaipur now is Dr. V.K. Goyal. Dr. Goyal, please go ahead and ask your question.
Hello, madam.
Hello, sir.
Let me ask how far thermal screening is reliable, because what we see that 80% patients are asymptomatic, and out of 20%, only 50% have fever. And there can be many causes of fever in the summer season.
Absolutely.
And we are doing thermal screening at airport, institution, hospitals. How far it is correct?
Yes. So thermal screening has been the first step towards, all the precautions that everybody is taken. Dr. Sharma, would you care to answer?
Yeah, sure. Thermal screening is just one part of the overall screening, because before thermal screening we usually ask the patient, we take a thorough history of person being in any contact with the corona patient, and is there any history of cough, fever, body aches, or any prodromal symptoms. If such symptoms are there, obviously person should be screened to further investigation. And the thermal screening just a part. As questioned by Dr. Goyal, thermal screening could be negative initially because there may not be fever. Some 20, 30, 40% patients may not have fever for 2, 3, 4 days. They may be asymptomatic for initial week. Still, they may be active cases and maybe spreading the virus. So, but still, thermal screening is just a part. If somebody is found to be having pyrexia fever, certainly this patient requires further evaluation and to be kept under observation.
Right.
So can I add something to this?
100%.
Yes, absolutely,
Sure.
Dr. Hardas.
I think, Dr. Sharma, you're absolutely right, but it also provides a very rapid isolation or a screening tool, because in a mass screening, and sometimes that the fever can be because of variety of other causes, but nonetheless, it is a tool which is very, very easily available, and it can probably detect people in problem, people who are actually patients and not just asymptomatic carriers, and help isolate these patients as soon as possible. So it's a good, quick test to isolate people who are infected or who are at a higher risk of having problems.
Right, absolutely. It's time to employ almost every tool that we have, no matter how small or big. Joining us now is Mr. Qureshi from Nanded. Mr. Qureshi, please go ahead and ask your question.
Hi, sir. Dr. Suhas, sir. Very good morning. Sir, my question to you is that are there any other pathies effective in COVID-19 like homeopathy or Ayurveda? And my second question is what precautions heart attack patients should take in these days?
Yes, Dr. Hardas.
That's a good question, Mr. Qureshi, because I think it is very, very relevant, and we know. I will first answer the second half of your question. What precautions should be taken by cardiac patients? If you look at the data, if you analyze the data, you will see that 3/4 of the patients who had severe disease or who had problems or who had mortality had some kind of an underlying comorbidity, which could be in the form of either heart failure, previous history of heart problems, history of having had a bypass surgery, people who are elderly, people who have had diabetes, hypertension, respiratory tract diseases, chronic obstructive airway disease. So the common denominator is that they have had some kind of a comorbidity or a problem. So these are the individuals who should be taking extra precaution, I would say, in preventing themselves from getting infested with corona. The first question was what pathies besides allopathy will work. I think a lot of discussion went on about the use of camphor in these patients. I think various experts have expressed their opinion. These experts have been from those pathies or have not been from these pathies, but nonetheless, a lot of rounds have already circulated on WhatsApp and other social media about the use of other pathies. I am not the expert to comment about these pathies, but I think at this stage, anything which has an evidence, anything which has got some basis, some proof, and is seen to help should be tried. Whether it is homeopathy or Ayurveda or allopathy, it really doesn't matter. The basic idea is to contain the virus by whatever means we can.
Right. We're going to take a very short break now. When we come back, we take some more callers on air and answer their questions. Short break now. Welcome back. We are answering your questions, and with me are two doctors, Dr. D C Sharma and Dr. Suhas Hardas, joining in on video calling. Let's take our next caller on air. We have Shailesh calling in from Pune. Yes, Shailesh, please go ahead and ask your question.
Good morning, doctor. My question is to Dr. Hardas, cardiologist. Recently, one of my relatives had an angiography done, and bypass surgery was suggested to him. But due to this pandemic, he has been advised to wait for a time. Now, I would like to know from Dr. Hardas, what is his suggestion in during this time, and now what should I be doing? That's my question.
Right.
Shailesh, as I understand, you are saying that one of your relatives has had an angiography just before the pandemic began, and now he's stuck and he's being advised otherwise. Is that right? Okay, the answer to this is that if he has had an angiography and it mandates the need for bypass surgery, he will need bypass surgery at some point in time. But it is up to your cardiologist, it is up to your cardiac surgeon to decide whether he should have it as an emergency or semi-emergency procedure even during this lockdown. And there are instances where an unstable patient requiring immediate surgery have been operated and are being operated as we talk today. But it is up to your cardiologist to decide if this person can wait until the lockdown is over, a normalcy begins, and thereafter we are in a better shape to deal with these patients. So I think the answer is it depends upon whether the patient is unstable, not unstable, whether patient can definitely wait for some more time when the picture becomes clearer, so that we will be able to cater to these patients electively and in a better fashion.
Absolutely, and you must have a dialogue with the doctor who's treating the patient.
Correct.
We've got Ravi joining in from Chennai right now. Yes, Ravi. I'm sorry, we have Pradeep from Thrissur right now. Yes, Pradeep, please go ahead and ask your question.
Yes, hello. जी नमस्कार, मैं केरल में हूँ, त्रिशूर में. अभी जून के महीने में यहाँ बारिश बहुत ज्यादा आने वाली है. Monsoons are going to hit the coast of Kerala. My question, sir, is that would the situation exacerbate or would this infection increase with the onset of monsoons, and it rains cats and dogs in Kerala? And what are the precautions that we can take in this regard? Please remember that in Kerala during monsoon, there are special diseases which come like chikungunya and some other kinds of fevers which are there every monsoon season.
Right.
Now with the COVID along with that, please advise some precautions which we can take in advance as individual citizens. Thank you very much.
Right. Dr. Hardas, weather and its effect on the disease has been on everyone's mind.
This has been said that countries which have a very hot weather, countries which have a very, very dry weather, will be partially immune to the bad effects or to a devastating spread of coronavirus. And probably the overall spread of this virus across the countries that we have seen are affected clearly shows that. Very, very cold countries and very hot countries are affected to a lesser extent. Now, what happens with the onset of monsoon is that probably we will have more fomites. We will have insects, we will have flies, which will easily carry these droplets from place to place. And we will have to be extra cautious in taking care of ourselves to make sure that we don't come in contact with these fomites. Fomites are the things that we normally come in contact with on day-to-day basis. For example, I touch the tabletop and then I touch my face. So I'm carrying that pathogen or carrying that virus straight from the tabletop onto my face. And it has been estimated that we touch our face 20 times a day. And 19 times out of 20 per hour, we touch our face 20 times an hour. If we can cut down these 19 times in 1 hour and touch our face only when it is absolutely mandatory, we are probably looking at some measures to contain this virus.
Right.
So we will have to be very cautious. There is a strong possibility that during humid weather, during rainy season, when the water will start flowing, when the mosquitoes will breed, when the flies will breed and flies will increase, the spread of virus is likely to be high.
Right.
We'll have to be extra cautious.
Right. Dr. Sharma, do you believe there are any particular precautions that we need to take thinking about the monsoons?
Yeah, as highlighted by Dr. Suhas, we need to be more cautious. The same principles of prevention like more aggressive following the social distancing, observing the hand hygiene, and also covering the face mask, avoiding going to the crowded places, avoiding meetings would be very important, especially in the rainy and monsoon season.
Absolutely. Thank you, doctors, for joining in and answering all these questions that our viewers called in with. And we hope that all our viewers will be extremely careful, not just in the monsoon season, but now this should be something that should become our lifestyle. Be careful, be safe, stay safe. Thank you, all of you.
Thank you. Thanks very much.